Do you take your heart for granted? Just assume it's in there doing its job, beating away? Well, if you do, you're like most Americans. So let's take a look at blood pressure, the most easily measured indicator of heart health.
High blood pressure is elevation of blood pressure, of the pressure within the arteries of the body. There are many definitions of high blood pressure. Not everyone in the world needs to be at 120/70. It depends on their other risk factors, whether you have diabetes, whether you have heart disease, heart failure, high cholesterol, cigarettes. All those things have to be individualized for the person. And it's really not going to be possible to get everyone in the world down to 120/70. 90% of people have what's called essential hypertension, which basically means we don't know why it's there. They just have it and they were born with it. 10% of people have high blood pressure due to secondary causes, whether it's kidney disease, certain hormonal abnormalities, but that's really the minority. So for practical purposes, it's plain old essential hypertension.
But why is blood pressure so important? Well, if you think of a pump pumping against higher resistance, eventually that pump might weaken or give out, and that wouldn't be so good. So, what can you do to avoid high blood pressure and improve our heart health?
What you can do is you can exercise regularly, meaning at least 3-4 times a week, a half hour to 45 minutes of some type of aerobic exercise. You can try to keep your weight down. You can make sure that your blood pressure is normal. You can get your cholesterol checked, physical exam, which should include routine blood tests, a risk factor analysis, evaluation of your family history, whether you have diabetes, whether you have high cholesterol, whether you have high blood pressure. And obviously the main thing for people who smoke, the worst thing they can do in their life ever for their health is to smoke cigarettes.
So let's talk about cholesterol. What is it? Well, cholesterol is a fat that circulates in the blood, and there are two main types.
There's good cholesterol, there's bad cholesterol. The HDL is the good cholesterol. The LDL, L for lousy, means bad cholesterol. That's how I help people remember that. Triglycerides are another kind of fat that circulates in the blood. And the good cholesterol is the type that actually can help remove cholesterol from the inner linings of the arteries. The LDL, or the bad cholesterol, helps deposit on the artery.
So cholesterol travels with the blood. The good stuff doesn't stick to the walls of the arteries, but the bad stuff does. And after a while, that bad stuff starts to harden or calcify, increasing resistance and forcing your heart to pump harder. Remember, the key to good heart health is keeping your arteries clean. And the best way to do that is with exercise, a diet low in fat, and of course, regular medical consultations. I'm Dr. Keller Wortham, and you're watching the eHealth Network.